Yet again tonight with the alarming situation in hospitals across our country, overwhelmed with a crush of COVID patients.
Health officials are sounding the alarm with a dire warning.
Things are going to get worse,
with the potential to become a pandemic.
It started with one of the owner's wives needing to get tested here locally in Omaha, and it was a mess. Partners thought, well, we can do better than this. By the end of the first week, we were seeing over 300 people a day. Omaha was our home base, our first location, and we didn't have any infrastructure at all. And so everything was kind of on the go as we built everything up. And as soon as we figured out our process, our computer system, we were like, all right, there's clearly a demand here. Let's branch out. We have the resources. Let's take this show on the road to other communities. Everybody was working hard. I mean, nobody was taking breaks. We catered food every day, and nobody complained. And it really boils down to everybody knew the importance of the service we were providing. This is the best way we could serve our community.
Prior to doing COVID testing, and I worked on the geriatric unit, so I worked with patients who were 65 and older, having to do the COVID testing. And when I would talk to my colleagues about that, they would always say, well, aren't you scared that you are gonna get COVID from swabbing other people? And at the time, I really just didn't think about myself getting COVID. I was just thinking about, I need to kind of help out the community, and we need to get all these people tested.
With Test Iowa sites closed for good, private labs are filling the gap.
As we sat in the parking lot of GS Labs, car after car rolled in for a COVID-19 rapid test. Dr. Casey Rice with Mercy One says testing is still critical. He says it's important to know if you're infected so you can isolate, and health experts can know what type of variants are circling in the community.
At the end of this pandemic, if there isn't ever an end, I want to still have that desire to serve. I want to still be happy that I'm a nurse, and I feel like we need to rely on nurses and everyone in the medical profession that we still want to serve our community. And having to do it during a pandemic is very hard. And I don't mean to get emotional, but I just still want to do what I love doing, which
the nurses never didn't answer the call, and we've got great staff. And it wasn't hard to find people willing to take on that challenge.